Welcome to all our viewers to Friends of Europe's Heart of the Issue, where today I'm going to be speaking to Mark Stabile, who is Professor of Economics at INSEAD. Mark, tell us, what do you think will be the impact on existing inequalities as a result of the COVID-19 virus?
Well, first of all, thank you for having me. It's a pleasure. And I think that there will be two big impacts. The first will be on health, and the second will be on income. Of course, they're related, but I think we can easily see at this point that COVID-19 will affect the health of those who are at the lower end of the income distribution more severely, very likely, and it's already affecting the economic situation of those at the lower end of the distribution more severely as well.
In what ways?
So on the health side, you need to put together two facts. The first fact, which we've known for some time, is that there are strong income health gradients. That is, people in with lower incomes have worse health. In particular, they're more likely to have chronic conditions. Data from my home country of Canada suggests that between the bottom quintile and the top quintile, there's a 15 percentage point difference in the probability of having a bunch of chronic conditions, cardiovascular disease, hypertension, etc. Now, put that together with the data that we know out of China that shows that in terms of mortality and morbidity, but mortality from COVID-19, the death rate, if you have some of these chronic conditions, is much higher. In fact, if you have cardiovascular disease or hypertension, the death rate has been between 6 and 10%. So much higher. So these people who have lower incomes are more likely to have those diseases. They're more likely to therefore suffer from the higher death rates from those diseases. That's the health side. Yeah. The income side is that many of them are in more precarious positions. So in many, many countries now, we're all being told to stay home, we can't work. Some of us are teleworking, like me. Others don't have the opportunity to telework. If you work in delivery or in manufacturing or in a number of jobs that there really is not the opportunity, sales and service to telework, obviously you're left without that opportunity. Some countries have put in place programs to help those who cannot work by guaranteeing their position or providing them with some income. But those who are in gig type work or precarious type work, if they don't have a proper employer, it's hard for them to take advantage of those kinds of opportunities. I had recently been surveying people who work for the gig economy, jobs like Uber Eats or Deliveroo that deliver meals to your door. They are not eligible for this type of support. Many of them are actually still working. So on the one hand, they're able to get some income. On the other hand, many of them can't work and therefore, or they're scared to work for their health. And so they have much lower, if any, income support at all.
Tell us, given your experience, you are you're a professor of economics. You've been watching and learning from what's happened in the last financial crisis. How more far-reaching and different is this crisis going to have an impact on the economy than our last financial crisis?
Yeah, it seems that to date, it is much more severe, right? The kinds of numbers we're seeing, the kinds of unemployment rates are, again, evidence from Canada, but also similar in France, suggests that the number of people who are unemployed or are seeking compensation or insurance for unemployment look more like the Great Depression than they do like the financial crisis, right? So we are in that kind of situation. The difference so far is it's been quite short, right? Time will tell whether this will go on for several years or whether it will be a very acute problem. Let's hope that it's acute, but the evidence does not suggest that it's going to clear up anytime very soon. So in terms of the immediate impact, and the same on the stock markets, the immediate impact has been harder than the financial crisis. It's also true that countries have responded with a lot of resources, a lot of stimulus. Country after country has decided that they're going to provide funds. And so it's possible that this will hopefully help people weather this storm and it will pull us out of it more quickly. But at this point, I'm prepared to say that this is a much more severe economic event than the financial crisis. And it has, of course, the combined health event, which is also severe.
So from your experience, tell us, does history teach us anything about what we're experiencing right now? Or is this quite significantly a unique set of circumstances that we have not encountered before in terms of the economic impact?
Well, I think we have had similar economic impacts. Certainly the Great Depression was a severe economic impact, the financial crisis as well. And although I am not as familiar with the data around it, I could imagine that flu epidemics and Spanish flu and other influenza epidemics in the past had severe economic consequences. I think what is a little bit different today, and I think is contributed in part to some of the damage that we're seeing, is how interrelated countries are, right? That we can
Indeed.
have the disease moving from zone to zone and the supply chain across the world being shut down in this way. The fact that there's so much more global interaction and travel allowed for the disease to spread. And so in this sense, it's a little bit different. In this sense, it's a little bit different. I don't think the circumstances are unheard of, but I think we were all caught off guard in terms of how quickly and how severely both the health and economic impacts were.
But it feels global and interrelated in a way that perhaps previous circumstances haven't been as such. And we've seen that governments have done the traditional thing, which is stimulus packages and washing the economies with lots of money, but we're not seeing an impact on that. Is there something to be thinking differently about how we use fiscal and monetary levers to get ourselves both through this and out of this?
Right. I think it's important to think about what's required now and how we might think differently afterwards. What's required now, in my view, there are two big things to do now. The first is to make sure that those people who suddenly have found themselves in very precarious circumstances, they can't afford, they're not working, and they can't afford what they need right now, that we support them. And so those kinds of stimulus packages that preserve employment, that make sure that you're not evicted, that basically firm up those who are least well off and at most at risk of immediate economic catastrophe, that we deal with that now. The second thing that we have to deal with now, of course, is making sure that we have those healthcare and public health policies in place to do our best to deal with the health side of this, right? We have to fight both the economic side and the health side, and that's what makes it a little bit more challenging more challenging than the financial crisis. And on the health side, it's important that first of all, that people need to do their part to minimize social contact, because that is how the virus spreads, of course, and then that there is some funding and cooperation in place, and this is where the international part is very important to supply the ventilators and the supplies that are needed as the crisis moves from place to place. Right. One of the things that is possible is that as it starts to fall in some places and rise in others, that we can see healthcare supplies move from where they're needed now to where they're going to be needed in a week or two. We just have to make sure that coordination happens. We haven't been necessarily great at that coordination
Indeed.
in the past, but we need to do it now. Then after this is over, I think one can take another look and say, okay, what about the economic system and what about the health systems in place could be improved? But that's a conversation I think that we should take seriously for 6 months from now. We can start to think about it for sure, but what's immediately required now is not a restructuring of the system for next time. It's to deal with the immediate impact that so many people are facing.
It occurs to me that how the markets have behaved, stock markets have behaved, how investors have behaved in these circumstances has confirmed our worst fears about greed and monetization and profit to a certain extent. Do you see that perhaps we might, out of this, emerge a different kind of international monetary financial system that's required? Because this kind of crisis is going to come and hit us again and again. I feel we're not going to be living in halcyon days where we have 10 years apart, because on the back of this, we have the kind of climate crisis also, which will equally have kind of a global impact, but also regional, continent-wide.
Yeah, I think a good signal of that will be actually what Europe does. The reason I think that is because, of course, we have been arguing back and forth about whether we should have more integration or less integration on the financial side in Europe for years and years. And here's another opportunity to consider, should we have Euro bonds, for example, that are spread over all of the member countries that use the Euro, and other mechanisms that are more than just national in place to deal with these kinds of crises. If we can see groups like the Euro group come together around this, maybe we'll start to see something emerge on the financial side that could be a bit stronger and more resilient going forward. But to date, that hasn't happened. So we'll have to see.
Imagine, this is my final question to you, this gets to the heart of it. If you were to be in charge of, let's say, the equivalent of a national treasury, you're a chancellor or you're involved in EU-wide financial discussions, what would you want to see happen?
In the longer run or in the immediate
Indeed.
run? Yeah, in the
I think both.
run,
I think the two are connected to a certain extent.
Yeah, so in the immediate run, I go back to what I said. I think we need to see those people who most need financial relief get it quickly. But we are seeing some of that. So on that's, if there's a bit of good news about the policy response, that's it. And on the health side, that the system is, we make use of the existing resources, which don't seem to be enough, but at least we make use of what we have in the best way possible. Going forward, I think we need to take this opportunity to take a look at. So one thing that came out of the financial crisis is that many countries went into austerity policies, and those austerity policies did many things, but one of the things they did was often cut healthcare budgets, right? In the UK, we've been talking about this for years. We now see the consequences of running these things too lean, right? Do we have the resources in place when these kinds of disasters strike? If you think it's one every 100 years, then it's a certain amount of slack in the system. But as you said, it doesn't appear to be one every 100 years. It seems to be much more often than that, in which case, have we run these systems without enough slack to actually account for this kind of event? And my guess is that after years and years of making them leaner and leaner, we have made them too lean. So one thing I'd like to see is a reconsideration of that. The second, of course, going back to the original question about inequality, is to take a second look at how precarious some people's lives are. And one of the interesting things for me coming out of this that I think needs some more thought is we have started to rethink in places that are locked down like France, we've started to rethink what's an essential worker. And we knew that healthcare workers were essential. I think everybody always knew that. But now we see that, in fact, grocery store checkout people are essential. They're the ones still working as we all line up for food. But these are people that have 0-hour contracts, that have no security, right? We're treating people that we, on the one hand, deem essential and need to be at risk during a catastrophe one way now, and then the rest of the time we treat them quite differently. And I think that needs a rethink as well.
Thank you. And I think you make that point really well, that actually the crisis, as we understand it, is redefining so much about how we as a society operate. But as you say, redefine roles, but also to think long and hard about what props up our local economies. And across Europe, we know the Black economy is by far the thing that makes those cities successful. So we're going to have to rethink what we do about that, but also learn lessons from the past, as you say. And as you say, put more slack in the system. But perhaps one of the points you're making at the heart of this particular issue is that we need system transformation to think very differently about the role of state, markets, and money. So thank you very much for being in conversation with me on the heart of the issue. And let's hope people listen to some of your advice. Thank you very much for being with us.
Thank you very much.